Thank you very much for having me. I really appreciate being invited to be here. I have nothing to disclose today. This talk is going to be about sexual health, and I wanted to begin by giving you a quote that I really like. It's from a meeting of experts at the WHO, and I love this quote because it really allows us to look at sexual health from a broad perspective and really from the diverse ways that we can look at this. So, sexual health is a state of physical, emotional, mental, and social well being in relation to sexuality. It's not merely the absence of disease, dysfunction, or infirmary. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. And I think it's so important because there's so many media messages around sex and sexuality and what is, quote, normal. But there's a lot of different types of sex, and there's sex with oneself, masturbation, there's sex with different people, and people have really different definitions about what sex and what sexuality is for them. I think it's also important here to note that abstinence, so the choice to not have sex, is a choice. And we want to make sure that we're actually including that when we discuss sex and sexuality with our patients and clients. So, what is sexual health? Again, I'm coming at this from a framework of a really broad definition. And I want to start today by talking about how I discuss sexual health with all of my patients. Again, I work with younger people, with adolescents and young adults and their children. But I think this really applies to everybody. And I think it's a nice way, especially when we're teaching new providers, to come at this with a perspective of diverse perspectives and really being inclusive in the way that we talk about this. So there's a lot of different kinds of sex, as I said. And I like to anchor this in two words, pleasure and desire. And I'm going to go into those and really using those as a way to talk to the people that we work with. Very important, sexuality is a normal part of growth and development. And we're going to come back to this again and again today. So, what is desire? Sexual desire can be described as a motivation, an interest in activities or sexual objects or another person. And this meaning of desire is really different for everybody. And it's very complicated. It's influenced by one's biology, psychology, society at large. People desire many things, might be pleasing a partner, feeling sexually desirable, having an orgasm. And it's really different for different people. And we really need to recognize that when we're talking about this subject. We think a lot about spontaneous desire because I think that in the media, there's this idea that you walk into a room, you see someone, and you have this spontaneous desire. But that's not reality. Mostly desire is responsive. So you don't need desire to be spontaneous because we as humans respond to sexual stimuli. And you don't need desire to have sex. And I think that's important to normalize for people. People have sex for many different reasons. It may make you feel closer to a partner, for example. It might increase your well-being. So there's really a range. And we want to be able to approach this from all of these perspectives so that people don't feel like they need to have spontaneous desire in order to have pleasurable sex. The second thing I like to focus on is pleasure. And that's about teaching people how to access pleasure. And that might seem like a basic concept or an obvious concept to people, but I think that we don't do this well enough. Certainly in my clinical practice, in short clinical encounters, we may not talk to people enough about how to access pleasure. And this is a real cornerstone to teaching people about healthy sexual relationships and about sexuality. Pleasure changes over time. What gives you pleasure? Different times of life, things may feel differently. And, having pleasurable sex can increase libido. So this is a nice cycle. So it can make you want to have more sex if that is something that you desire, that's part of what you want for your life. Um, it means different things for everybody. So it's nice to give a really broad type of education about this. So talking about the anatomy, how do certain anatomical parts, like how do you get pleasure out of them for yourself? If you're touching yourself, how do you give pleasure to somebody else? How do you get it? And at different life stages, this pleasure can change. So aging processes, pregnancy, menopause. So different things are going to feel good at different times based on these life processes. Illness is another big one that might change the way that your body feels or how you can use your body. And then sexual experimentation, another important cornerstone to providing education. I just talked a lot about a sort of a general framework of how I like to approach sexual health and talking about sexuality. And I really want to emphasize here that all of these things that I've talked about and the things I'm about to talk about really apply to everybody. This is a general approach, but I do want to spend some time today talking specifically about sexuality and individuals with disabilities. People with disabilities are sexual, have diverse ways to express their sexuality. There often is an erroneous belief in society that individuals with disabilities are not sexual. Sometimes, alternatively, people are seen as hypersexual, and I'll talk about that a little bit later. This idea that people are not sexual might be due to sort of a societal framing of individuals with disabilities as childlike. But most people are sexual beings, and people desire love, intimacy, companionship, and people with a range of disabilities are able to have healthy relationships. And it's really important to stress that people with disabilities can have satisfying, positive sex, and they can have sexual relationships. I also want to anchor this in this conversation as a human right to have safe opportunities and places to explore sexuality. And that's why it's so important to not avoid this topic, but really dig into this topic and make sure that people understand their rights. Denying people an opportunity to express themselves sexually can actually increase vulnerability to abuse. So perpetrators may offer opportunities for independence or offer opportunities for sex. So it's really important that we are not denying people this opportunity to express themselves and give independence where it's appropriate. And this independence is important for growth and development. So we want to make sure that we are not just viewing individuals as dependents and not providing them with this guidance and talking about, when this is appropriate and how to express sexuality in appropriate ways with appropriate people. We always want to respect autonomy and, again, acknowledge sexuality and an ability to have intimate relationships. I think there's just a general discomfort with sexuality in society, especially around young people, and even more so often with individuals with disabilities. And unfortunately, this discomfort can result in providers or educators or even family members not providing sexual education to individuals with disabilities. And again, this comes back to this idea that, people are dependent, they're not going to be having sexual relationships in which they're equal partners. And this is really doing a disservice to individuals. Also, by not allowing social interaction, so isolating people as a way maybe to protect them is also detrimental, because social learning is how we learn about relationships. So there's a lot of trial and error, and we can only get that by being exposed to other peers. It provides learning experiences. And this is part of educating individuals on healthy relationships. Part of sexuality and talking about sex and sex education is talking about pregnancy. So whether you are a person who is able to get pregnant, or somebody who can get somebody else pregnant, it's important to talk about pregnancy intention and preferences. And these preferences can range from wanting to get pregnant, not wanting to get pregnant, or being ambivalent. And those are all valid feelings that we need to explore with our patients or clients. If pregnancy is desired, it's a right that individuals have. There are a lot of assumptions that are made about individuals with disabilities and their ability to care for children, or if their children will have disabilities themselves. Important to not make those assumptions, to first actually have a conversation with our patients about what are their desires, what are their preferences, and really use that as the starting point for having this type of conversation. I want to now move to sexual education. So I've already talked a bit about it, but I think this is the important part of talking about sex and sexuality. Really, so much of it is the education that we can provide. There are so many physical and emotional changes during development that happen to everybody. And in order to help with this growth and development, we need to provide education on sexual health, right? Because as I said, sexual health and sexuality is a vital part of everybody's growth and development. So providing sexual education should be a really broad topic, and it should include, issues of how to perform self-exploration. And then certainly relationship safety. So giving the skills that people need to have safe relationships. And then contraceptive methods. So this goes back to what I was just talking about in terms of pregnancy preferences. If appropriate, certainly talking about contraceptive methods. Often this conversation is left out because assumptions are made that individuals with disabilities are either not having sex or should not be having sex. And both of those assumptions are very dangerous, because it prevents people from giving information. And so everybody deserves to have information that's relevant to their health and to their reproductive goals and desires. I want to spend a little more time here on self-pleasuring, because I think it's important. It's important sometimes to be able to give permission for this, because people may not know about it, or may feel uncomfortable with this topic. But we know that it's a healthy outlet for sexual desire. Of course, there are appropriate contexts for expressing or for self-pleasuring. And so it's important, individuals, for example, with intellectual disabilities may need very concrete examples of public and private spaces to be able to explain, where are appropriate contexts for exploring oneself. But that's an important part of this education piece. And I think that it's not only educating the individual, but it's also educating the family, anybody else who is caring for the individual, or anybody in their community. Everybody needs privacy, and everybody should be given some privacy for self-exploration. Certainly, sexual education should be prioritized like all other aspects of healthcare. For example, in schools, if that's where somebody is receiving sex education, people shouldn't be pulled out for other needs such as additional therapy or tutoring or support. Sexual education should be seen as a vital component of everybody's education. There's sometimes a misconception that individuals with intellectual and developmental disabilities are hypersexual. And this can be a result of individuals expressing their sexuality in inappropriate places. And that's because they've lacked education potentially on places to express their sexuality or education on who are appropriate and inappropriate people to express their sexuality with. This is important for everybody to have inclusive sexual education practices, so LGBTQI and gender inclusive. There should not be assumptions made about who someone's sexually attracted to. We know that there's a real range of feelings and there's a diverse expression of sexuality among ourselves, so within ourselves and then also across different populations. So important to keep this in mind when we are talking about sexual education. We do know, unfortunately, that individuals with disabilities, especially developmental disabilities, are more at risk for abuse. There was a study by the National Center for Victims of Crime that showed between 2009 and 2015, individuals with disabilities were twice as likely to experience violent victimization. And they said that included rape, sexual assault, aggravated assault, and robbery. And most individuals were abused by people they knew. So we want to educate people on healthy relationships, and we want to be able to provide skills, really concrete skills on how to engage in healthy relationships. Part of that means reviewing consent, what it is, why it's important, how to verbally state consent, and how to continually verbally state consent. So for every new act that someone might be engaging in, they need to be able to verbally consent to that. And then also giving examples of good and bad touch, and then how to report and who to report to anything that the individual is concerned about. So because many people have experienced abuse, which is a type of trauma, I think it's a nice thing to be able to really use a trauma-sensitive framework. By using this type of framework, you don't exclude or further traumatize individuals who've experienced trauma. However, this is useful for everybody, and I use this framework for talking about all kinds of issues with my patients, not just sexual health, but especially in this arena of sexual health, it becomes very important. Trauma-informed care is a strengths-based approach, and it's really an understanding of the impact of trauma and how that impacts the individual for the rest of their life. Specifically, it's a good framework as well for individuals with disabilities in talking about sexual health because it really creates an opportunity for individuals to be empowered and to have a real sense of control. There is another presentation in the conference today about trauma-informed care, so I'm not going to go into it too deeply. I do want to just highlight some of the ways that I think that it specifically can be used for sexual health. This is the framework of the Substance Abuse and Mental Health Services Administration. There's a lot of different approaches to trauma-informed care, but I like this one. It's very concrete. It's an easy thing to remember. So first, it's about understanding of how trauma affects individuals, and then a real recognition of the signs of trauma, and then to be able to respond in a trauma-informed way to individuals at all parts of the agency where individuals are receiving care. And then, most importantly, really resisting re-traumatization. So creating systems, creating environments in which people don't feel like their stress is increased, so that we can decrease stressful situations that may re-trigger certain individuals. And I want to just go through these key principles of trauma-informed care as they pertain to talking about sexual health for individuals with disabilities. So first of all, safety. So we want to create a free of judgment, an environment that is free of judgment or shame. We want to create affirming environments where people feel safe to talk about their sexuality. And this is part of, providing transparency and trustworthiness. And this is really achieved by allowing people to understand the context and give them information that are going to help them make the decisions that will affect them. And this is really built by giving comprehensive information, which is why I spent a significant amount of time today talking about education. And peer support. So peer support, as I said, is providing community. And this is so essential because it's a mechanism for individuals to teach one another. And I think that that is really powerful, and it really builds social connection, which is key to development. Collaboration and mutuality is allowing individuals to take some ownership of their learning experience. So not just dumping a bunch of information that we as the provider might seem relevant to us, but really allowing people to tell us what is important to them, or what do they want to learn, and what tools do they think they need to be successful. And that leads us to empowerment, which is really giving people voice. And this is very important in society. Individuals with disabilities often have no voice. And so giving people an opportunity to hear from the individual about what they want, what they need. For example, what are their reproductive goals? What are their goals with sex? What are their goals with their pleasure, desire? Really listening to those and helping people to achieve them. Cultural, historical, and gender issues. This is, of course, all of these are really important for everybody, but for everybody really to consider the multiple identities that individuals embody, that some of those identities, there are structural inequities that really impact the way that people can receive care, and in terms of discrimination against certain individuals, certain populations, that all impacts the way that people can engage in healthcare. So we really want to make sure that we are considering that when we think about how we're talking to people, how we're planning, how we're developing care plans for our patients. I want to pivot now. This might seem like a big pivot, but I think that it's important because when we talk about sexual health and sexual education, it doesn't only include how to negotiate sexual relationships or how to talk about sexuality. It also includes how to take care of ourselves and our own sexual health. So I think this is really important to talk about healthcare maintenance, not just for providers. So not only a good reminder for those of us working in healthcare, but also for our patients. And I really see this as part of health equity. So we don't want to leave out any groups. So for example, like individuals with disabilities, if we're making certain assumptions, we don't want to leave them out of a conversation about what screening should happen for individuals to help keep them healthy. And so I think this is an important thing to educate our patients on in terms of healthcare maintenance. So I'm going to go through some of the important healthcare maintenance pieces for both clinicians and patients to know about. So again, there are a lot of different guidelines for things, so I'm not going to go through every type of guideline for every healthcare maintenance thing. This is from the US Preventative Services Task Force, so many people use this. This is for Pap screening, so Pap smears or cytology. So we want to start at 21. 21 to 29, we're going to not do HPV testing. And then when individuals are older, 30 to 65, we will add in HPV testing. There's a couple of different options here. You can either do every 5 years with HPV testing, or every 3 years with just the PAP, or every 5 years with co-testing, and that's the PAP plus HPV testing. And then for most individuals, we're going to stop around 65. So these slides give a little bit more detail so that you can go back and look at them. Some new guidelines recently came out from the American Cancer Society, and it's from 2020, and they're actually recommending a new approach to testing, which is testing people for with just a primary HPV test, which is a test alone. Unfortunately, this is not really available in many places. And so they say that, if the primary HPV test is not available, co-testing every 5 years. So that's with the HPV and the cytology, or cytology alone every 3 years. So I hope that, in the future, we'll have more access to this primary HPV testing, because this is going to be really a good leap forward for cervical cancer screening. And then vaccination. So, speaking about HPV, so human papillomavirus, recommending it for all of our young people, 9 to 26. It's a very safe vaccine, preventing cervical cancer. 27 to 45-year-olds, really like a shared decision-making between patient and provider. And this is pretty new, this recommendation. So it's important. So we have patients that are much older now who we should be engaging in discussions about this particular vaccine. And then hepatitis B vaccine, recommending it for everybody. This slide I know is busy, but I did want to just give you all the information up there because it's a little bit complicated with the new guidelines, so that you can kind of reference this later if you are interfacing with patients who might need sexually transmitted infection screening. So these are from the newest guidelines from the CDC. And they're for chlamydia and gonorrhea, and it's depending on whether you're a man or a woman. So that's referring to if you are assigned male at birth or assigned female at birth, based on your age and based on certain risk factors, whether or not you need screening for chlamydia or gonorrhea or both, and just looking at how often we need to be screening people and really engaging with them. That's why it's important to be able to talk about sex and sexuality, because you need to know what your patients, your clients are doing in order to help advise them and give them the most recent information about, what is recommended from the CDC in terms of screening for sexually transmitted infections. And HIV recommended screening test for everybody, starting around 15 years old, and then certainly, more often if clinically appropriate. And then hepatitis C, at least once in a lifetime, for greater than or equal to 18 years old. And again, also with additional risk factors, screening more often. And then breast cancer screening, this also varies a lot between different organizations. So this is just an example of one guideline from American Cancer Society. And this is for women of average risk. So if they have increased risk for various reasons, there's a different guideline. But just looking at, individuals 40 to 44, starting to talk about potentially starting mammogram every year. And then moving to, 45 to 54, really getting a mammogram yearly. And then over 55, switching to a mammogram every other year, or potentially staying with the yearly. So again, these are all really conversations that are individualized to our patients, based on who they are, their reality, what their comfort level is. But so these are just some nice guidelines for providers. And finally, just to sum up, I want to just encourage everybody to, encourage individuals to have satisfying sex through their lifespan, and whatever satisfying sex means for them. That may be not having sex with themselves, having sex with others, and talking really about sexuality as a natural, healthy part of development for everyone. And I can't, stress that enough, that this is really something that we want to talk to everybody about, and talk about it in the framework. If you liked what I presented today about, this framework, not just the absence of disease, but really talking about the emotional, physical, social part of sexuality. And I just want to leave you with, everyone deserves the possibility of pleasurable sex without coercion and violence. And these are really important points. And I just encourage all of us to really take the time to provide our patients, our clients, with the skills they need to navigate healthy relationships. So that is my time. And thank you very much. I look forward to questions.
Thank you very much, Sarah. That was great. And I just want to make a quick comment that in terms of mammograms, it's been my experience that women who use wheelchairs for mobility experience great difficulty in getting mammograms done, even at our own wonderful institution. So we need to do a better job with that, just FYI. So one of the questions here, which got a lot of thumbs up, was, often families are not on board with a person with a developmental disability expressing their sexuality. So they don't want to talk about it. They don't want to address this issue at all. So how would you talk to the family about that?
Yeah, I think that using a framework of partnering with the family and partnering with the individual. Some of the things that I like to talk about are that providing more information actually keeps people safer. So that giving more information rather than less is actually a way to protect individuals, because it gives them ability to be able to recognize potentially, what are appropriate or inappropriate things that they're noticing, or if someone's touching them inappropriately. But giving more information is never a bad thing, and presenting it really from that perspective about this is about helping families to in the end, actually protect the individuals in their lives, and to be able to give the tools that are needed to navigate healthy relationships, and to talk about it, I think, also in a lot of different ways. So I think talking about, that's why I like a frame of self-pleasuring, because I think that's a hard topic to talk about with families, especially for individuals who have younger children, for example, or potentially individuals with disabilities that people feel like they don't want to be giving a lot of independence. But to talk about really a skill that we can provide that actually helps to allow someone to explore the range of sexuality in terms of what gives them pleasure. And then that is really a fundamental human right.
That's great. I like that approach a lot. There's a comment here that I think is really interesting, which is police need to be trained to take a sexual assault report from a person with a disability and their family. So police training, I don't know if you have any exposure or experience with that.
Yeah, it's a great question. I am actually trained as a sexual assault forensic examiner, and I worked doing that for a while, and certainly saw people come in, from all spectrum, and some of them individuals with disabilities. And I saw that that was really lacking, because once they get to the hospital and have somebody like me who's trained as a sexual assault examiner, who has skills to be able to ask questions in different ways, that doesn't always happen first. So the police may be doing the questioning first. They might be the first on the scene. So really important to have that training. Again, that inclusive, I think, trauma-informed training for police officers. And in San Francisco, we're pretty lucky. We do have a sexual assault, a special victims unit that have specially trained detectives. But again, that's not always the frontline police officer. So I think advocating for that people here are from a lot of different disciplines and areas and service sectors. So I think it's important for all of us to really advocate for those types of trainings.
Yes, great. So how about men? So you didn't include anything on men there. So what about male sexual health, such as testicular cancer? Yeah.
Yeah, so great. So in the new CDC guidelines for sexual health and the sexually transmitted infection, they've removed the recommendation for doing testicular exams.
Really?
And yeah, so this is
Huh.
a new thing, and sometimes providers, it's a catch up to, what is the evidence base. And because this has happened with talking about breast cancer screening, for example. Are we actually preventing morbidity and mortality by doing these exams? And actually evidence has shown that doing testicular exams does not prevent morbidity and mortality. So actual recommendation to not be teaching our young men. I was taught in school at 15,
Mhm,
start doing it,
mhm.
because, testicular cancer is a cancer of young men. But it's actually, the evidence has changed on that. So I don't think there's anything wrong with providing education about anatomy and talking to people about it. But I want to put that forward, that the evidence actually doesn't back up teaching or performing testicular exams anymore.
Well, that's interesting. I guess I'm not up to date on those guidelines. Um, we have about a minute left. There are several questions. Are there any good handouts to give parents or families about sexual health? So in your resources, was there a link to a good handout by chance?
Yeah, so I in the bottom of some of the slides, I did use. I really like Advocates for Youth, and again, they do a lot of research and policy around youth, but I think that it really can be generalized to everybody. So they have resources on specifically sexual education for young people with disabilities. They also have talking about sexual education for youth in general. And since this conversation should start young, I think that it's a nice place to start. So I have that website listed in the bottom of some of the slides. So there's a lot of fact sheets there that I really recommend.
Okay. We're out of time, but I'm wondering if you could respond to some of the questions in the Q&A. If you could respond to one, I think there's a good one about the rights of adolescents and youth around birth control. So I think that's an especially important question. But there's at least 6 other questions that we have not had time to get to, which I think goes to the importance of this topic and our appreciation for you taking the time out of your busy clinical and academic schedule to be with us today. Really appreciate it.
Thank you so
So
much. It's been a pleasure.